Now let's return to the struggle to contain the outbreak of a new coronavirus in China. Professor Sian Griffiths is a public health expert who co-chaired the Hong Kong government's inquiry into the 2003 SARS epidemic. Earlier she explained the similarities and the differences between the two viruses.
Well, it's on a larger scale, but there are many similarities with SARS in that it's a coronavirus thought to have come from the wet market. The organism jumped from animal to man, and it produces flu-like symptoms and then can go on to pneumonia. So far, that's fairly similar. The differences are that when we did the inquiry in 2003, we found that really there'd been very poor flow of information right early on in the epidemic, and and in Hong Kong we had been unaware of the cases in China. So it was only when the disease spread to Hong Kong that really the world was able to focus on what was the organism. So there's much better sharing of information. You've seen that all the time, the regular updating of the number of cases and the sad numbers of deaths. We have a fully informed picture. It's a global picture. The communication is much better. Scientists are collaborating together effectively to develop. Test for the organism has been developed, and that in itself was a major step because it was done much more quickly. And there's also work on a vaccine, although that won't come into play really for this phase of the epidemic. So there's a lot more information flow, and the authorities have acted very authoritatively in trying to contain the disease in Wuhan. Now, there are all sorts of rough edges to that containment policy. It's very difficult when you're dealing with millions of people to actually to stop all flow of people. But we do know from the people who have had the disease outside of China that there are usually links to Wuhan. So the policy of trying to stop travel is working to some extent, but at the same time, the other thing we found in SARS was that people weren't prepared enough, both in terms of the facilities in hospitals and in terms of the knowledge in the general public. And I think you'll find there's plenty of public information now. 2003 social media wasn't as active, and we didn't all have sort of our phone. We didn't use our phones as much and email as much, but I think you'll find that people now genuinely know that they need to take their own precautions. So wash your hands. If you have a cold and you put a tissue across your mouth when you sneeze, and then dispose of the tissue in a bin. Don't just leave it lying around. All those things, the very simple hygiene measures will actually help protect individuals and also decrease spread at the same time as the other larger steps that are being made. So I think also we understand that what you don't want is patients turning up. They think they've got the disease, they've had a contact with Wuhan, and they go and sit in a surgery or in an accident emergency department.
So in that case, what should they do? Just briefly, if you will, because we don't have much time.
Contact in advance and then make sure that you're put in isolation. Because the worst thing you can do is go ill into an environment where you've got people who are already immunocompromised or feeling ill and spread the disease there. So I think we did learn those lessons from SARS. They are being put into place, but obviously this is a new virus. We don't know how the virus is going to develop over time, and it's very important that the science continues, the vigilance continues, and we all play our role in trying to contain the disease.